We're so exuberant in the market, whether it be personally, about artificial intelligence. I'm interested as to how you're seeing your own product iterate. We're all about now prediction, not just assessing how I might feel on the day or the inputs that I'm getting, but predicting how I might in the future.
Yeah, we've been doing AI for many years. The thing that's most interesting is that the predictions that we make generally are short term. You might be getting sick in a couple of days, your cycle's coming in a couple of days, and they're very accurate because they're short term. But I think where this starts to get really interesting is if you can make predictions over a longer time frame, you're starting to help people understand how their behaviors can bend the curve on their health outcomes, or maybe even ultimately on the cost of healthcare. And I think this is really disruptive, but also really positive, because one of the biggest problems with healthcare is there's just simply not enough care to be provided for everybody. And AI lowers the cost and provides access and provides medical information. It has to be high quality, it has to be scientifically validated, it has to be accurate and good, but that opportunity exists. And so we're pretty excited about how AI can transform healthcare.
At the moment, an Oura Ring is deemed a general wellness product, but there could be even further ways in which you move within the medical space.
Yep.
That requires FDA approval, particularly for blood pressure, for example. How are you thinking about that, getting the science on board?
Well, our view is that we want to be as aligned with the FDA as possible. We want to make sure that what we do is in the path of scientific and medical validation. That includes the FDA. So we're working closely on multiple submissions. Blood pressure is certainly one of them. We're currently running something called the Blood Pressure Profile Study. That's almost 300,000 people who are taking cuff measurements and comparing to the predictions that the Ring is making. So we will have a data set that'll support the idea that what this does is accurate, validated, clinically relevant. Until that time, we'll probably operate as a wellness device, which means that we can provide insight, but not something that's like a diagnosis. We'll stop short of that.
Look, the FDA doesn't have someone at the top right now. Does that affect the way in which you work with them?
Yeah, no, not really. I think we're very excited to see how we can work with CDRH, which is the division of the FDA that focuses on that. So we're working with the rank and file, the people who are focused on medical devices, and we have a great collaboration with them.
You have a great collaboration with Apple, but you're also kind of frenemies in some way, dare I say it that way. Where you've taken some significant talent from them.
Well, I think the interesting thing about how Apple and Oura interact is that it turns out that almost 2/3 of Oura ring wearers have a second wearable, most often a wrist wearable, and most often an Apple Watch. So we're actually highly complementary. Now, going to the people, there's great talent. Apple has produced some of the icons of health and hardware, and I think having some of those people join our team has been an incredible I don't know, we feel very proud of the people who've joined us, and we've got some great connectivity with Apple as well. I'm a long-time independent software developer on the Apple platform, so we have a lot of people that we have been working with for years.
Software developers are not cheap in this age of AI. How are you thinking about your talent more broadly?
So for us, the interesting thing is about a year ago, people were like, wow, I mean, hardware's hard. Why are you doing hardware? And of course, the first rule of software school is you don't do hardware.
Yeah.
And so I missed that class or lesson in software school, but it's worked out okay. Because now what people tell us is they say, we can't believe how resilient you are to the AI disruption to software. Turns out hardware's very, very attractive right now because you can't vibe code atoms.
Yes.
Right? You can't just summon them into existence. And so, interestingly, I think for Oura, steering the way we have, and having always been a hardware company with a very strong software backing, it's actually been really advantageous. And investors look at us and they say, good, we're so glad that you're not in the software space and that you're a hardware provider. And
you've just been luring more investment, and you got a bigger market cap on the private side. I'm interested as to whether there's any inflationary pressures your investors are worried about. How are you thinking about manufacturing in this age of supply chain? We think about Hormuz, we think about China today.
Yeah, I don't think we've really had seen the impact of inflation on demand, which is good. We've certainly seen some inflation impacts on kind of supply chain, but nothing material. And interestingly, last year, of course, there was all this drama about tariffs. And I think as a company, we were quite lucky. One, we actually announced an intention to have a factory built in the U.S., and so that's actually one really interesting outcome of that. It's just underway. We'll let you know when it's all rolled out. But at the same time, I think we also were able to, because we manufacture around the globe, be very careful to sort of manage the tariff issues very effectively.